Hello, I'm Yesenia Taveras. Welcome to La Conexión, the Connection. The AI Tupon Hospital for Children's recent expansion was designed by families for families. I have here with us Chris Manning and Tammy Santiago. Welcome to the show.
Thank you for having us.
Thank you for joining us. Well, let's start off with this major expansion. Can you tell us a little bit about the details?
Yes, of course. We started this planning about 5 years ago. We know that it was important for us to give our patients private rooms, and this is where we started the conception of the development of this building. And about 3 years ago, we broke ground and began the construction project. And I think we accomplished what we wanted to do, which was obviously to give everyone a private room. Mm-hmm. But we also were proud to say that during the process, we involved not only the associates, like doctors and nurses, but we also involved families and kids in the design of the building.
¿Y en español puede decir los detalles de este edificio?
Sí, cómo no. El edificio tiene 144 cuartos, todos privados. Cada cuarto tiene 3 áreas principales. Un área para el clínico, un área clínica, en un área para el paciente que tiene todo el equipo necesario para el paciente. Es donde está la cama, su televisor, un área para conectar sus juegos, y también tiene un área para las familias. Ahí está un sofá cama donde ellos pueden dormir cómodamente, tienen su propio teléfono, su propio televisor. Es todo bien cómodo y bien privado para la familia.
¿Y por qué es importante para tener un cuarto solo para un paciente?
Pues además de obviamente la privacidad, también sabíamos que era necesario darle un cuarto cómodo para que los pacientes se puedan mejorar más pronto y para que la familia estuviese disponible para quedarse con el paciente y darle un poquito más de el hogar. Ese sentido de hogar fuera del hogar de su casa.
Okay, and in English, can you also share with us, Tammy, the importance of having this single patient room for these families that are coming in with their children?
Yes, I think it's very important to give everyone that private room because it actually helps them, besides being just the private room, it gives them also a home away from home for them to have privacy with their families and for the families to come here and stay with their children and having the comfort of being able to do so.
Yes, and in addition to the single patient rooms, the emergency department has also moved into this new expansion. So can we touch a little bit of basis on how large the actual emergency department is now?
Oh, that was very exciting actually, because the previous emergency department had about 22 rooms. We actually not only moved to a brand new area, but expanded the room to 44 rooms, so we pretty much doubled the space on rooms, not only giving them also wider hallways, and the artwork is designed by children, the colors are great, everything is just a positive, wonderful thing for the emergency department.
Yes, and Chris, can you also share with us the design layout here in the hospital?
As you pointed out, and as Tammy mentioned, it was really important for us to make sure that the needs of our families were met first and foremost. So this expansion by families for families really took into consideration from the very earliest part of the design process through when we were actually picking the finishing for the furniture, the considerations of our patients, the kids, and their families. And so starting from that, we asked the children in particular, what do you want it to feel like? What do you want to experience when you're here? And they said, we don't want it to feel like we're going to the post office. We want it to be light and bright, and we don't want it to feel necessarily like we're even in a hospital. And so we kind of started with that. The colors of the building, the way that the spaces are laid out really puts families first and foremost. There are pocket parks, little spaces where families can get away when they want to leave that patient room. We're obviously located on the beautiful grounds of Nemours Mansion and Gardens, and so we brought a lot of those natural elements into this process as well. We did, however, want to make sure that it was functional for our nurses and for our physicians, and so we created this idea of neighborhoods. So instead of these long hallways that you typically find in a hospital hospital, we kind of have these almost curved spaces that are very easy to get from one room to the next, or from where the nurses and the physicians are working to each one of those rooms, so that they have less space to travel. It's easy for families to interact with them, and that generally speaking, it just makes for a much nicer experience for everyone.
And when one thinks of bringing their child to the hospital, there's a lot of stress involved. So what other details went into making this such a light and bright, vivid place to be at? And plus nature, there's also a part where people can come outside and enjoy nature.
Absolutely.
Can you touch a little bit about that?
So you'll find a lot of glass, including this atrium that we sit in today. Brings in a lot of natural light, which is, we know, not only just nice to look at, but also contributes to the healing process. Tammy mentioned some of the artwork. We went out to communities around Delaware, Pennsylvania, and New Jersey, asking schools to provide us with their students' art, and really to kind of bring that community feel into the facility. When you come into the atrium, it's not meant to be just the front door to our hospital, but also a community space where we can bring in local school groups or choirs or musical acts. We can even show movies here. So all of that, I think, brings together this idea that yes, it's a place to receive high quality medical care, but it's also a place, especially for those families who are with us for a very long time, that can be that home away from home and really give them a comfortable place. There is a very exciting discovery wall presented by DuPont in the atrium, which is a first of its kind sort of interactive display that is probably one of the showcase elements of this first floor of the hospital. So,
especially the part where you can let the rain come out of your hands.
Yes, we worked with a design company out of California. This is the only one in the country this large, and it serves two purposes. It really does give folks an entertainment option, a way to sort of, kind of stop for a moment and have a little bit of fun. We see just as many parents over there as we do see children, but it's also a therapeutic device, and many of our physical therapists worked with the designers to figure out how could we use those for children who are able to come down to the atrium to kind of further their ability to get back on their feet, and to do that in a very fun way. And with the support of DuPont, we really were able to accomplish that.
And the garden that you have outside as well, you can actually see the older building and the new expansion. I thought that was pretty neat.
Yeah, the healing garden on the second floor almost provides a natural bridge between the existing part of the hospital and the expansion. And again, it's just a nice, quiet place for families to sort of go and reflect, whether they just need to sort of be by themselves for a moment and be surrounded in nature, or they just want to get a breath of fresh air.
And was there a lot of community support when this expansion came to thought?
Yes, we've been very blessed to have so much support from our community, from our elected officials and state leaders, from corporate sponsorships from DuPont and AstraZeneca, as well as just some really amazing sort of personal contributions. Our associates gave generously, the community gave generously. The atrium that we sit in today, the Anthony and Fusco Senior Atrium, was supported by a $5 million gift from Mr. Fusco. The gift shop as well benefited from a $1 million donation from the Abyssinia family. So, and then we had a community day, and we had 7,000 or 8,000 people who came just to kind of see the space. And many of them had their own stories and reasons for being here, but we didn't know what to expect, and we were pleasantly surprised by how many people came out on a Saturday just to see what we were up to.
Y Tammy, si alguien entre este hospital y quiere más información, ¿dónde necesita buscar la información cuando entra el edificio?
Tenemos este escritorio al frente, muy cerca de la entrada, el Welcome Center. Ellos pueden venir y siempre hay una persona que le puede asistir. Si no habla inglés, siempre se puede buscar una persona que le pueda asistir para tomar cualquier tipo de información que necesite. Y obviamente en nuestra página de web también pueden buscar información at nemours.org.
Gracias. And could you share with us too, she was letting us know when someone comes in to look for information, where do they actually go in the atrium, and also if there's a website?
Sure, absolutely. When families enter into the atrium, the Welcome Center is off to the right. You can't miss it. There's smiling faces waiting to help. There's a brightly colored mural behind the Welcome Center, so it should be easy to find. And for those who are looking for more information online, www.nemours.org, nemours.org.
Wonderful. Thank you so much for your time. I really appreciate having the both of you on the show today.
Sure. Thank you for being here.
Thank you for having us.
Thank you. More of La Conexión when we return. DuPont Hospital for Children has a new international medicine program fit for families and referring physicians around the globe. I have here with us Maggie Lynch, who's going to tell us the details about this program. Welcome to the show.
Thank you.
Well, thank you for joining us, Maggie. Let's start off with letting us know what is international medicine.
So international medicine is the care of children from around the globe who seek us out for specialty services. Our patients are patients whose permanent address are anywhere outside of the United States.
And why would a child or a parent of a child from another country seek some help here in the AI DuPont Hospital for Children?
So we get inquiries from patients, from families, from physicians from all over the globe. They look to us for our expertise, our specialty services, our technology. Physicians in the United States have advanced training, exceptional knowledge, and families everywhere recognize that. Nemours, we're world-renowned for cardiology or orthopedics, our hematology and oncology, and people look for us for those specialties.
And how many countries has the hospital already served patients from in the last year?
In 2013, we saw patients from about 17 different countries. In 2014 to date, we've seen patients from nearly 27 countries.
Are there particular countries that the hospital caters towards?
There are. We focus our efforts on trying to help children from Middle Eastern countries, South America, Central America, as well as the islands in the Caribbean, so Bermuda, Bahamas, the Cayman Islands. Those patients, much like our friends in South America, the travel is short. Direct flights right to Philadelphia International Airport, and then we're only a 25-minute drive from Philly Airport, so it's nice and close for the families. It's easy in, it's easy out, so it makes sense to reach out to the patients in those areas and offer our resources.
And is there a special need or condition that you look for with these patients in other countries?
So we don't necessarily go out after our patients, they come to us. We may market in those areas, but those patients tend to seek us out as a result of our marketing, our website, different outreach from physicians. We are known for our orthopedics. We started when we first opened our doors as an orthopedic institute, and we still are world-renowned for our orthopedics, for pediatrics. People often come to us also for our cardiology services, our solid organ transplant, bone marrow transplant, hematology, oncology, and at our sister hospital in Florida, we have a limb lengthening program and world-renowned interventional radiology program as well.
So if someone had a relative who was looking for these type of services to provide for their family and wanted to bring their relative over to receive these services, what can they expect from this program?
So most of our referrals come from previous patients or family members who live in the area who know what we have to offer. In international medicine, every patient is paired with a nurse, someone who will take that initial inquiry, review the medical record, and ensure that the family is paired with the appropriate medical specialty. And then that nurse will follow the patient through their whole continuum of care here with Nemours. They will help with the planning before, any sort of appointment scheduling and processing during their stay here, and then do any follow-up that's needed after they're gone.
And does the program provide any type of language translation services for the patients who have relatives that cannot speak English?
Yes, so we're very cognizant of not everyone speaking English. We want to be as appropriate as we can and aware of people's cultural, religious, and language differences. We have a bilingual staff member on our team who does speak Spanish. We have interpreter services. Every patient will have an interpreter at their very first consult or appointment at minimum. We also have iPad interpretive services, language line interpretive services, and if needed, we can assist with getting medical records translated, though we do prefer that they're translated before they come to us, because that will expedite the process once we have the medical records.
That's wonderful. So the hospital is really doing its due diligence in reaching all these different countries.
Yes.
And also insurance. Health insurance is a big topic. I can only imagine the type of challenges one has in another country. So how does the hospital assist these families with insurance problems.
Right. So much like the United States, insurance is a hot topic everywhere. We do have direct contracts with many of the international insurance companies. If someone has an insurance that maybe we don't have a direct contact with or contract with, we will reach out to them, and many times they're more than accommodating. They recognize that the family is coming to us for a specialized service that most likely they're unable to receive in their home country, and they work with us very closely to make sure that the patient gets exactly what they need and that the coverage that the family is paying for carries over to the United States.
Maggie, I think this is a wonderful program. I mean, you're really reaching out to these different types of countries. Was there a type of belief that the hospital believed in, that every child should be served?
Yeah, so at Nemours, we've been serving children from around the globe since we opened our doors in the 1940s. Patients have been coming here for orthopedic specialties. We started as an orthopedic institute, and we've grown to a full-service hospital. With the new expansion, we're a hot topic on everybody's minds. We do want to help as many people as we can, recognizing that there's a lot more children in the world than just our immediate region. While we're known for our charity services, we are very selective about what international cases we will provide charity to. We will review each case as needed. While we want to help everyone around the world, we have to recognize that that can be a bit of a stretch.
Yes.
So we will work with every family, review each case, and determine need and feasibility.
Maggie, also, if someone wanted to start this process today, if they wanted to reach out to a relative and say, hey, you know, I think you can really benefit from this, what is the process? How do they need to start?
The best thing for families to do really is to check out our website. It can be found on the Nemours homepage at nemours.org. And on that website, they'll find information about all of our team members, our medical director, our financial specialist who works one-on-one with the families to make sure that an appropriate payment plan or insurance company is arranged. They can also contact us directly through that website. It's a secure application. It goes to a secure email account. And then someone from the department will actually reach back out to the family via their preferred method of contact and start the process of gathering medical records, working with the medical teams to make sure that the appropriate specialty is involved, and then move the process forward. Many times it moves very quickly. Other times, depending on the case, it may take a little while till we come up with the most complete, comprehensive care plan for the family.
Wonderful. I really appreciate you sharing all this information with us, Maggie. Thank you.
Thank you.
Thank you. More of La Conexión when we return. AI DuPont Hospital for Children is really working hard on reducing the amount of inpatients that are coming in with asthma-related cases. I have here with us Erin Carroll, who's going to tell us about the hospital's initiative in really reducing the amount of children that are coming in with these asthma-related cases, or they're wheezing, they're coughing. I mean, there's just so much going on, especially now that it's wintertime. So let's start off with letting us know, why is the hospital focusing on asthma-related cases?
Sure. So asthma is a chronic disease, and it is an inflammation of the airways in the lungs. So it could be life-threatening at times if there are exacerbations that occur. And 1 in 11 children have asthma. So in 2012, we were the recipient of a Healthcare Innovation Award through the Centers for Medicare and Medicaid Services. And through that award, we have really been able to enhance our patient-centered medical home in our practices by bringing on community health workers and community liaisons to help us to address this disease in children.
How is the hospital approaching this problem?
So this is the first time that we've been able to have workers in the field, and that's what's really innovative for us, and it's very exciting for us. So we're really able to take our work and go into the homes of these families that will have us, and we're able to do healthy home assessments. So we look around the home for triggers that might be exacerbating some of the issues for these children. We're also able to provide a snapshot of these families' lives back to our providers. So there's a more comprehensive understanding of some of the other barriers that might be occurring that prevent these families from being able to connect to services at our practices.
Erin, there's so many different types of triggers when it comes to dealing with a child who has asthma, and the cases are different for each child. One may wheeze more than another child, and one might have more frequent visits to the hospital than another child who has asthma. So what are some of the triggers that these community outreach representatives look for when teaching a family what to look out for?
Sure. So there are allergens in the home. That could be dust mites, it could be scents. There are smoking. Tobacco is a big one. There's also air air pollutants that can occur. And so what we want to do is we want to mitigate those factors to the best of our ability. And so some things that we could do that we offer to suggest to the families would be to wash bedding once a week in hot water, to put bedding encasements on the mattresses and on the pillowcases, to keep smoking to a minimum, if at all, in the house. If there is smoking, that it occur outside the house. And so really looking at opportunities that we have to be able to address those issues in an immediate way to help resolve the triggers that are occurring in these homes. And so, like I said, if there's an exacerbation, it could be life-threatening. So what we really want to do is the opportunity to make sure that these environments are as safe for these families and these patients as possible. And that could even be like for mold, for instance, cleaning with warm water and soap and not using some of these astringents that families are usually known to purchase at times to clean the home. It doesn't have to smell clean to be clean.
Right, exactly, understandable. And education is very valuable here when trying to teach someone about how to maintain a child who has asthma. And so you have your different types of inhalers, you have Flovent, ProAir, there's so many out there. So it's very imperative to have this type of teaching mechanism. Now, what other type of services does the hospital provide for those who are living here in Wilmington, Delaware?
So we have 3 pilot sites through this award, and these pediatric sites that we have serving our patients have the availability of the services of our community health workers. And so, as I mentioned earlier, our community liaisons really help with our local coalitions, and so we want our community stakeholders and partners really being able to rally in the community too, and addressing some of those other issues such as idling at schools and such. And so with the community health workers in particular, they have the more immediate connection with the families in the homes. And so at our practices with our patient-centered medical home, we have a care team. And so on that care team, we have a care coordinator, we have the community health worker, we have the provider, we have a community liaison, we have an asthma educator. So we're really able to have a coordinated, comprehensive approach for these families. I can give you an example that one of the statewide partners that we've been working with is the Delaware Housing Authority. And so we've really been able to make a connection with them and having some trainings that are being done for those in public housing to, again, make sure that the environments that these children are in are as healthy as possible without the triggers that will exacerbate the disease.
So how are you reaching out to the Hispanic community here in Delaware?
Great. We were very deliberate when we hired community health workers. We were able to hire 9 community health workers and more recently a 10th located at our hospital now.
Wonderful.
But from the original 9 community health workers, 2 of them we wanted to be bilingual. And so we really thought it was important to reach our Spanish-speaking families. And in particular at Seaford, we have a large Latin American community. And our Spanish-speaking community health worker has really been able to make an impact for these families who are now more readily accessing services at our practice and receiving better care. And so it's made a difference.
And that's wonderful having these type of services available in Spanish as well, because like I said, being educated is the #1 thing when it comes to trying to reduce these asthma-related cases in the hospitals. And also, can you tell us a little bit about the community workers? What do they actually do when they go out to these houses to try to educate these families?
Sure. So it's really important for us to meet the families where they're at. And so when we go into their homes, there are a lot of other social economical issues for these families that they're trying to deal with. And so at a minimum, we look to provide services by connecting them to resources in the community. So some of them might need assistance with housing. Some of them might need assistance in the summer with getting air conditioning because it's not good to have the windows open.
Yeah.
And so we look for opportunities in the home that will help the families then focus on asthma. So then asthma becomes the primary focus and not an irritant to families because it is scary and it is life-threatening.
Yes.
And so when we go into the homes, we're also looking at doing healthy home assessments, like I'd said before, and we're looking for those triggers and we're looking for ways to help make these environments free of these triggers. And so aside from connecting resources with these families into the community, we're also looking to empower and encourage these families to be more informed and better equipped to know how they can work for improving the health and quality of life for their children.
And Erin, how does one receive a community outreach worker to the house? I mean, it's very imperative to have a pulmonary doctor should you have asthma-related symptoms, but how can one receive a community outreach worker to their house so that way they can get educated on these different types of things?
Sure. So if you're at one of our a patient at one of our pilot sites, what we do is we also make referrals to in our system, and so our care coordinator also helps with that.
Okay.
And so there is a process process we have in place where we try to make those connections in our hospital, whether it's through our pulmonology department or other specialists that are needed to help deal with other issues for these children.
And if someone wanted to contact or reach out to this program, what do they need to do? Is there a website? Is there a phone number?
So in particular, as a resource for asthma, you can go to our Kids Health website, and they have newsletters available, and they also have tip sheets on asthma that would be really helpful. And as far as the services, we do have the 3 pilot sites, one in each county, and the community health workers are assigned to those sites. And as I'd mentioned, we recently were able to bring a community health worker into the hospital. And so that community health worker is working with those families who come into our hospital through the emergency room and they're admitted. They have a diagnosis of asthma, and the whole point is really to reduce the likelihood of a readmission in 30-day period. And so any of our 3 practice sites where our community health workers are located, we have one at Jessup Street, we have one at Dover Peds, and we have one at Seaford Pediatrics.
And before we leave, now that we're going into the winter season, is there anything that you would like to leave with our viewers in regards to trying to reduce these asthma-related cases?
So as you had mentioned, weather is a trigger also, and what we want to make sure that we're doing is that we're bundled up. So definitely putting the scarves on, making sure that we have our mouths covered when it's really cold out, making sure we have a rescue inhaler on our person when we are traveling, especially to and from the bus stop for those children that take the bus or for those children that are walkers.
Well, Erin, thank you so much for your time. I really appreciate you coming out on the show today.
Thank you.
Thank you. And on behalf of all of us here at WITN Channel 22, I'm Yesenia Taveras. Thank you so much for watching, and have a great day.